The International Conference on Patient Safety at Hyderabad, which was the second time that we were organizing this conference, brought together 1,000 healthcare professionals, clinicians, nurses, administrators, IT professionals, representatives from companies that produce products, devices, solutions that play an important role in patient safety. This was by far the largest conference of its kind in the country, and it was really heartening to see the response. In terms of the program, we started with accreditation, got the ISQA perspective, the Joint Commission International perspective, the viewpoint from the Quality Council of India, CAP. We looked at tools to measure patient safety. We looked at how to improve outcomes. We had sessions where delegates could speak. We had an interactive session with the media. We looked at nurses, and there were several free papers, and we also presented the Apollo standards for clinical care. We also at the end signed a Hyderabad declaration with 6 initiatives that would take forward the patient safety agenda, not just in India but in the region. The Apollo standards for clinical care bring together the ACE at 25, which is Apollo Clinical Excellence, at 25 our dashboard, Rocket ACE, the Apollo Quality Program, the Apollo Critical Policies, Plans, Processes, the Apollo Mortality Review, the Apollo Incident Reporting System, all as part of a dashboard that we refer to as the Apollo Standards for Clinical Care. We've now had this in place for some time. We've had ACE for 3 years, and now we have lots of data, and it's really heartening to see how these initiatives have helped improve outcomes and have had an impact on making our facility safer for patients. What we've seen with the data collection that we've had with this Apollo Standards of Clinical Care is that all these initiatives have improved outcomes, have put patient safety center stage, and have clearly been initiatives beyond accreditation that have proved to make our facility patient safe. What we've seen with all the data that we've had with the Apollo Standards of Clinical Care is that the outcomes have improved, our facilities have become safer, and patient safety has become center stage. These initiatives, along with all the other initiatives that we have for accreditation, have clearly made a significant improvement. Transforming healthcare with IT was a very interesting conference. This was a conference that we organized for the 3rd time. It brought together IT professionals and healthcare professionals to work with each other, to learn from each other, to be able to offer solutions that can actually make such a difference in the way we deliver care. IT has revolutionized the way we live, the way we talk, the way we communicate, and we could clearly learn a lot from IT and use some of the solutions that IT has to offer to make the care that we provide at healthcare institutions safer, more effective, and of course more reasonable. So this unique event, which has now really become quite an important event in the calendar of health IT conferences across the globe, really brought some of the brightest minds from more than 25 countries together, and has been really a spectacular success.